Welcome back to Lary Talk, everybody. I am your host, the amazingly averaged Henrique. How's it going? I hope you're having a great Thanksgiving week, and I hope you're enjoying family and friends and getting to chow down on your basic turkey. We, on the other hand, are going to do something within the cow area because honestly, I like steak more than I like the environment. No, seriously, I want to get some steak or something because not only do I like not following trends, I haven't been able to really eat them all 2 years. So yeah, I'm getting my share. I am eating what I haven't been able to eat. Let's put it that way. And then again, the teeth are still a struggle while eating, but we power through. This week's episode, folks, is going to be about chemotherapy and my experience going through. And then a very exciting time for me. We actually have a guest on Lary Talk for the first time ever. It's amazing. I suckered somebody in. But before I get to all that, as always, because he's such a great guy, look up Aaron Wayne and you can get his book, The Silent Partner, My First Year as a Laryngectomy. This is all about Aaron Wayne's take on the first year he became a laryngectomy. It's funny. It's a good book. It's a very good book. And he also makes these little stickers that you can put on your HMEs. Now, you can't really see mine if you're watching on video. If you're watching or if you're listening to us on the podcast, it's the show's logo. They're a little dark in the light, but you know. So if you contact Aaron, he'll send you that book. And he might send you some stickers if you ask nicely. And if you go to a Facebook and you look up the group Silent Partner, you'll find a Facebook group. So shout out to Aaron, like I normally do. Look him up, great guy. Now, let's move on to this week, talking about chemotherapy. Let me go through my experience a little bit. Now, I want to start by saying I got extremely lucky through my entire process from chemo from surgery to chemo to radiation to having my TEP installed. If I didn't get that lucky, I wouldn't be able to do this, what I'm doing right now. So don't let it think that like it goes over my head how lucky I am. Everybody's different. Every procedure is different. Every chemo is different. So what might work for me might not have worked for you. What works for you not going to work for somebody else. It all depends on the people. But most people get the general nausea from chemo. Like when you think chemo, the first thing you think of is like bald head. And you go lose a bunch of weight, blah, blah, blah. Which sometimes is the case, but it all depends on the type of chemo. Much like aspirin, there's different types of chemo, you know. So it all depends on what you got. I got cisplatin. I got 3 doses of it over a period of time. And I was doing chemo and radiation together. Now, what a lot of people don't realize is, yeah, I got it 3 times. But within all that time period, I was in the chemo area every day for hydration. Now, chemo takes a real toll on you. It pretty much stops cells. Like if you watched an earlier episode, I went over the entire history of chemo and what it does. Stops your quick cells from quickly producing again. So your stomach lining is like one of the first things that goes. That's why you get nauseous. And it's bad, man. Like it gets bad. You get a bunch of pills to counteract some of the side effects, which some of the pills counteract the pills, and that kind of thing. Again, all depends on the people. You know, for a while, I had 3 different types of pills I was taking. And, you know, every day going into hydration. I was able to kind of maintain my weight. Like I lost a bunch of weight. Now, mind you, a lot of weight. But I don't think it was from like the chemo, really. I mean, I don't have a throat anymore. I couldn't eat what I wanted to eat. I had 5 teeth in my mouth and I was eating from a tube in my stomach, a peg tube. So you're going to lose some weight there. You're not eating the normal stuff you would. And I was not a healthy guy. I'd be eating cheesecake at 10 o'clock at night, you know, and then go to bed. It wasn't, I'm sure some of you did the second supper, stuff like that. So yeah, it wasn't like I was eating healthy. I was not taking care of myself at all. And, you know, I did lose a bunch of weight. Originally, when I got diagnosed with cancer, I was 320 pounds. I did drop down to 212 pounds at one point. But again, on top of the chemo thing, I think it was all the other stuff because I was able to, you're able to keep your weight up by using the Ensure and other products that you just put in the tube. Or a lot of people don't realize this, you can just blend up things. As long as your puree are blended up real well and it's nice and liquidy, you can put it in your feeding tube and eat whatever. You know what I mean? You just got to make sure you clean your tube out afterwards and you're good to go, man. So if you want to like blend up some soup, do it up, man. Broth and stuff like that. You can do that. And that'll help you maintain your weight. As far as like the hunger, like I wasn't hungry because I was starving and I didn't really lose my appetite either. I was just every couple hours putting in an Ensure in my tube, calling it a day. And I'm not one of those people that are like, I didn't eat 3 meals a day and all that stuff. It was like one giant meal at the end of the day, which is so not good for you either. So that aspect, I think I got real lucky. I didn't lose any hair from it. Some of the chemo, you'll lose your hair. I didn't lose any. I actually, I lost more hair during radiation down here than anything. There was a part like the last week of I got my final dose, and then like a few days later, it knocked me out. And chemo is like radiation; it doesn't just you're automatically out of it. At least I don't think so. For the most part, everybody I've heard it takes a couple days before you start feeling it, even a couple weeks. With me, I was fine until that last week of it. The last week of it, I was down and out. I wake up long enough to eat, take my meds, and fall right back to sleep. Without even trying. I'd just be sitting there trying to watch TV with my wife and just fall asleep. And she eventually got worried about me. And when we went for my hydration portion, I was trained. And normally I would drive myself to and from all these appointments, whether it be like Rochester, which is 2 hours away from me, or it was just going to the local hospital for my hydration radiation. I would be the one driving, mainly because I just like driving. So, but she got worried and I couldn't drive. So she drove us up and mentioned to them that, I wasn't feeling right. And as soon as they seen me, they knew I wasn't feeling right. In case you can't tell from the podcast, I'm a happy-go-lucky kind of guy. I like to be fun and social and make people laugh and that kind of thing. So when they see me and I'm just sitting there covered up and passed out, they knew something was wrong. So Cindy, the woman you're going to meet in a little bit, got me out of that. And that is the only pill I've ever taken where like that I felt better. Next day, wide awake, had energy, felt great. Like nothing had ever happened. It was like a miracle drug. But I got real lucky, I think, honestly. And I think my positivity going into it, not dwelling on it, not being depressed, and just going in, power through, rolling with the punches. I think that helped out a lot, honestly. That, and I did have a great team around me. The nurses was amazing. My nurse practitioner and doctors was amazing. My surgeon was amazing. My SLPs are amazing. So like I got real lucky in that part. And I suggest you do that. Don't settle for like whatever. Find yourself a good team. And that means at home too. Find yourself a good team. You don't need negative Nancy's around you. Okay. You just don't need that. You already got a giant negative. You don't need any more. And when you're going for medical, you want somebody that's top notch. You don't want some schmuck, right? You don't want somebody that's telling you the wrong information. Or maybe you do. I don't know. So all in all, I mean, chemo does suck. It has its moments, man. But I got real lucky on mine. And hopefully, and I'm sure some of you will be that way too. There are going to be some of you that run out of it like I do. And there's going to be some of you it's going to kick your ass. And I mean, it's wiping out your immune system. It's totally wiping you out, man. And rebooting your system pretty much is the way I look at it. It's like unplugging and plugging it back in. Did you try unplugging it, plugging it back in? So that to me is pretty much what chemo was. And again, I did them with radiation. So at one point, it was kind of hard to tell the difference between the side effects because a lot of them are kind of the same in some spec. But all in all, I didn't have a really bad time. Now, the long-term side effect, a lot of people get different things. Like with me, I got a constant tingle in my fingers, which isn't enough to bother me really. And I can never keep them warm now. I can never keep warm to begin with. It was like 60 degrees today and I'm fucking freezing. I'm like, what the hell? So that's really weird, especially coming from like 320 pounds and you're sweating when it's -10. Yeah, that's weird for me. When I lived in Florida, I didn't stop sweating for 4 years. I don't know how people did that. So, I don't know how fat people survived there. It's probably why there wasn't a lot. The other side effect that I got is that my eyesight's starting to go. Now, same time, I am 42 years old, so it was bound to happen. Eventually, my father had glasses by the time he was 37. My mom has glasses just normally, so I mean, it was coming, but at the same time, the chemo made it kick in more, and it's not that bad. I probably need it for reading. And I also got to learn to pull my finger away from the HME when you go to breathe in. With that noises, in case you're wondering on the podcast. So that was my experience with this stuff. And it wasn't, like I said, I got lucky. It wasn't that bad. So this brings me on to the next portion of the show, something I'm very happy about. I get to interview the nurse practitioner for Cayuga Medical Center. She's a hematologist specializing in oncology. She was my personal nurse practitioner, Cynthia Davis. She's a great lady. I think you guys are going to enjoy the interview. I think we rocked it. And without any further ado, Cynthia Davis. All right, man, I want to welcome our first guest to Lary Talk. She's a nurse practitioner for Cayuga Medical Center. She's for hematology and oncology, Cynthia Davis. Cindy, how are you doing?
I'm doing well. How are you?
I am doing great. So we're just going to do this little interview. And unlike a lot of places, you go on the internet and you'll see doctors and stuff. They're usually doing interviews for a product or for the place they work, stuff like that. We're going to go in more detail about you as a person, and then we'll go into like chemotherapy and your profession.
Awesome. Super excited.
Okay. So let's start it off by where you're from.
So I am from Lansing, New York. Been here my whole life, born and raised. Compared to where we are in terms of our hospital, on the other side of the lake, but still same community, same area that I've been my whole life.
Same county. It's fun.
Yep, pretty much.
What does your parents do for a living?
So my dad works in construction and my mom does human resources accounting stuff. So nobody in my family works in medicine.
Nice. What made you want to get into medicine?
So I initially wanted to get into medicine when I was working at a residential facility for adults with developmental disabilities, and I was doing their day-to-day care. It's really the first time that I started thinking about nursing and medicine as a career.
And how many siblings do you have?
I have one older sister, and she works in medical billing. So I guess technically she's in the medical field.
Kind of. We'll give it to her.
We'll give it to her. Yeah, we'll give her a pass.
So what made you get into medicine? Where did I go? Yeah, what made you want to get into medicine?
So specifically oncology. My grandmother was diagnosed with lung cancer in 2011 and was actually treated here in the same facility. So it was that interaction and that relationship that she built through her treatment and that we built together that brought me back around into oncology.
Where did you do your schooling at?
So with my initial nursing degree, my undergrad degree, I went to TC3, which is a community college in Dryden, New York, and then worked as a nurse for about 10 years, and then went in to get my bachelor's degree at Upstate Medical University, and then transferred to Binghamton University for my master's degree.
I like Upstate Medical. I had my surgery there for back in 2010. So
Yeah.
Let's see. Okay, so you're in a hematology and oncology specialist. What can you explain to people what the difference is? Like one studying blood, one studying cancer. If
Yeah.
somebody doesn't know anything.
Yeah, exactly. So hematology is really the study of blood abnormalities. So that could be anything from anemia to blood clotting disorders to blood clots like DVTs and PEs. And oncology is certainly the study of cancers. So lung cancers, myeloma, melanoma, all of the gamut of things.
Right. And the list keeps getting longer and longer.
Indeed. Indeed.
Okay. What's the most challenging and rewarding about your job?
Yeah, I think those things are mutually exclusive, I think. So I love building relationships with my patients. It's one of the things that I pride myself on because you spend a lot of time with me. I spend a lot of time with you. So I want to have that relationship where I can walk in and say, hey, Henry, how's Mel doing? And know about your family and your life outside of being in the clinic. But it's also in building those relationships that can be challenging when you have to have those difficult conversations or when patients pass and you have to, have that reality set in, right? It's those difficult emotional situations that is hard.
And you're really good at it too. Like really good. Like Mel loves you. And I've never gone to your office like, oh man, I gotta go see Cindy. It was always like, I gotta go see Cindy. So you're very good at it. Let's see, what would you say has been your biggest achievement in career and in life?
I would say hands down, my biggest achievement is being a mom. So I have 4 kids at home, 16-year-old, 14-year-old, 12-year-old, and 10-year-old. And I think it's important for me and for them to see sort of challenges and struggles throughout your adult life, right? So they were there when I went through grad school and wanted to quit every day. And they saw sort of the payout, right? They saw that struggling is okay. And it's okay to have those moments, but you can't give up and sort of push through all of that. So seeing them see me, right? And seeing those successes has been so fun, so fun. And I love where my career has brought me. I never thought that this is where I was going to end up. So.
Right. You got a busy household, man.
Yeah. Yeah. There's a lot of kids.
and the way I look at it, like a kid from the 80s, man, no retreat, no surrender. So.
Absolutely. Yeah.
All right. So now on to some tough questions here. These are going to probably be the hardest ones all day.
Uh-oh.
And what's your go-to, burger or a pizza?
Oh gosh, I think most consistently, I would say pizza. I can definitely go for a good burger every once in a while, but pizzas never let me down.
Right, as a New Yorker, I always go for the pizza. But
absolutely.
Who don't like a good burger? What's your go-to ice cream?
Oh gosh, so that really depends on my mood, but my staple would be cookie dough. But in the summer, I'm a twist with rainbow sprinkles kind of girl. So.
And Ben and Jerry cookie dough, right?
For sure. Yeah, there's no other.
Okay, what's a better pet, cat or a dog?
Oh gosh, so I actually have both. I have cats and dogs and a dog. So I think cats are easier, but I think dogs have more personality. I think I'm going to have to go with dog.
Right. I've always looked at a dog as like a child, and a cat's more like the old man that's sick of your
for
shit.
Sure.
Yeah,
yes.
like
yeah.
I'm tired of you, and this don't belong
Please
here.
Get away from me. You're in my house, and I don't want you here.
Shame on you for putting a cup right there. You know?
Right. Right.
Okay, so this is a question that gets me to know what a person is like. So, what is your favorite? What would you rather see, Star Wars or Star Trek?
Oh, you're not going to like this answer, but I say neither. I am not a fan.
I am really shocked on that answer. Actually, I wasn't expecting that kind of answer. So I should probably include that in, or neither.
Yeah.
I grew up with a dad that grew up in the 60s and 50s and stuff. So like he was a huge Star Trek fan, but like, so if I had to choose, it's always gonna be Star Trek, but I'd rather take a good comedy.
Fair enough. Yeah. Yeah.
Okay, so now we're gonna get on to the treatments of chemotherapy and stuff like that. You're a professional, what you do for a daily basis. So in an earlier episode, I went over the whole chemo history from being discovered with the mustard gas up to Richard Nixon signing up so people can actually study, which gave us different types of chemos. And patients different. The patient side effects can all be different. For someone that hasn't had any research or is just about to begin treatment, can you explain the common side effects and what they can expect? What kind of long-term effects would they be likely to have?
Yeah, absolutely. So part of my daily job is to have these chemo education sessions where we spend an hour or so hashing out the details of your treatment and what those side effects can look like. Most chemotherapy side effects overlap. So it doesn't really necessarily matter which chemotherapy you get. We can give you that general overview. So cancer at its basic biology is a matter of rapidly dividing cells or sort of some kind of chaos in the cell division cycle, right? So chemotherapy addresses that, but in doing so also addresses all other rapidly dividing cells in the body, which can include skin, hair, and nails, the GI tract, and the bone marrow most often. So things like low red blood cells, low white blood cells, low platelet counts, nausea, vomiting, diarrhea, constipation, dry skin, hair loss, brittle nails, breaking nails, darkening of the nail beds. And then certainly every chemotherapy medication has specific side effects that are unique to that particular medication. So things like kidney dysfunction or neuropathy and other kinds of things that we would review.
Right. Like when I went through chemo, I just assumed I was going to lose all my hair. Like that's the first thing everybody assumes. And it all depends on what kind of chemo you're actually getting.
Absolutely. Yeah. People are often worried about the hair loss and then the GI symptoms, right? They think they're going to be bald and stuck in bed sick as a dog. So.
Right. I feel like I got really lucky with mine. Like I handled it pretty well. I had that one rough week and you guys gave me Ativan. And what is it about Ativan that made it counterbalance everything?
So we use Ativan a lot for its anti-nausea properties, actually. So it's basically, it's used mostly for, as you know, anxiety, but we use it because it works really well for nausea.
Is it because it like coats the stomach for you? So that way your stomach lining, because a lot of people don't realize the stomach lining wasn't, it's a rapid reproducing cell.
Absolutely. Yep.
So I know that wasn't in the questions. That just came to my head. Mm-hmm.
Yeah. A little bit of a remix here.
Right. Well, and according to medical field, a lot of people in the medical field, immunotherapy seems to be the treatment in the future. Can you explain for someone who hasn't heard of the treatment what it actually is?
Yeah, so I think you're right. I think immunotherapy is definitely the up and coming thing. There's a lot of research being done on immunotherapy and the benefits and what cancers it can treat. What immunotherapy is doing is using the body's own immune system to attack and to fight cancer. So side effects tend to be less severe and less, unless they do develop, then they can be a little bit more significant. So they're not as common, I guess I should say. Side effects are not as common, but can be more severe if with immunotherapy.
What are some of the side effects?
So side effects of immunotherapy can be with any organ system, right? Because it's your body's immune system. So at any point it can attack any organ. So things like pneumonitis if it attacks the lungs, hepatitis if it attacks the liver, nephritis if it attacks the kidneys, dermatitis if it's a skin reaction, colitis if it attacks the colon, certainly any issues in the endocrine system, so thyroid issues, diabetes, those kinds of things.
And what kind of cancers does this work for that they know of right now?
So it's, like I said, lots of research being done. Most commonly, we use immunotherapy for breast cancer, lung cancer, melanoma, kidney cancer, occasionally. Head and neck cancers is up and coming research being done for that.
Okay. And some have received chemo and immunotherapy together. Will chemo eventually be phased out?
I don't think chemotherapy will ever be completely phased out, only because we need that sort of fallback plan, right? So if immunotherapy doesn't work, we need to have something that can still treat the cancer, right? I do think that eventually it's going to be the standard of care that, right up front, you get immunotherapy and then chemotherapy is used on an as needed or, backup plan.
Right. When I was doing my study on immunotherapy, I was like, earlier episode, I mentioned Dr. Coley, who back in the 1800s didn't really believe in washing hands, keeping things sterilized and stuff like that. Yeah. And in fact, they would inject tumors with bacteria and it didn't really help the patient at all. Right. But because of that study, because of what he did, they were able to study that, and that's how we got vaccines and stuff like that. So that's how you got your flu shot and the COVID-19 vaccine, working with the proteins, and it's all from some guy that didn't want to be clean.
Right. Exactly. Exactly.
Yeah, I couldn't picture surgery back then. That'd be nuts. So let's get into the cannabis topic of this.
Yeah.
With cannabis becoming legal across the country, especially with the medical field right now, is it still controversial in the oncology world?
From my perspective, it's not controversial because there are so many great benefits to using medical cannabis. So we use it most often for pain control or nausea or stimulating appetite. Sleep can certainly be helpful for things like anxiety and depression, seizures. There's so many great uses for it that I wish the federal government could get on board.
Right. Yeah, I was really amazed when New York totally passed it across the board. I didn't
I
see
did
it
not
coming.
see it coming, for sure.
Yeah, no. Like I got all giddy when I got my medical card, and then like it was like 7 months later they passed it. I'm like, well, that's bullshit.
Totally, right. I did all this work and now look.
Right, right. So smoking cannabis is obviously bad for you. Putting anything in your lung that's not oxygen is clearly bad for you. It's logic. But eating cannabis has been beneficial in many ways. But what is the pros and cons about it? And can it mess with your chemotherapy at all?
So it doesn't generally interact with chemotherapy. I would say the biggest side effect or the most common side effect that I review with my patients is things like decreased reaction time, so lethargy, sort of increased sedation or fatigue, just knowing that you're not going to be as on top of it, right? If you're high,
Right,
for
right.
lack of a better term. We all know
Right.
or assume what it's like to be high, and it's essentially the same thing.
Right. I honestly believe people need to try it more, but
I so agree. There are lots of people I wish I could hand it out to.
right, right. It's like, here, you need to calm down.
You should try this.
Okay, so let's get onto this whole pandemic topic for a minute. Other than becoming the Zoom master, because like everybody now knows Zoom. So I wish I had bought stock in Zoom, honestly.
Seriously, yeah.
Yeah. So how did it change your practice?
Yeah,
Your
so
daily
fun
thing?
fact, I actually started practicing here in February of 2020, and then COVID hit in March of 2020. So
Wow. So I'm like one of your first group of patients.
you really were. Yeah,
That's cool.
yeah. So aside from, I don't know that it would have changed my training so much, but yeah, a lot of our interactions were on telemed, and I don't think I saw your whole face until the end of treatment when I said, can I just see the rest of your face?
Yeah, yeah. That pulled mask. I remember that actually.
Yeah. And it's true for a lot of my patients. I don't think that if we ever get out of this world where we can take our masks off, I'm not sure that I would recognize them. So it added another layer of challenge, right? So trying to, like I said earlier, trying to build those relationships while also, maintaining safety for everybody involved, it was a little difficult. And certainly you don't get those same relationships over a video screen. That's for sure.
One thing I did like about the pandemic, there was nobody there. Do you know what I mean? Like you go
Absolutely.
to a waiting room and it's like you.
And it was just you. Absolutely.
Right.
Yeah.
I don't like people standing that close to me anyway,
Yeah, we have that in common.
Right. It's like back off, dude. 6 feet, even if we're not in a pandemic.
Right. Give me some space.
Right. So with the COVID-19, everybody had to worry with chemotherapy because it wipes out your immune system, basically a reboot. Yep. Other than the normal things that they were telling, what would be something they would tell people to avoid germs and stuff like that? Would have been the same thing as what they're telling you to do now to avoid COVID?
Yeah, I think those recommendations are likely the same. So frequent hand washing is a mainstay for avoiding infection, right? Washing your hands frequently, avoiding people who are actively sick, certainly avoiding large crowds. I think the difference that I'm not sure we would have recommended before would have been the masks. I just don't think that we had that same, certainly when we were sick, we were wearing masks, but it wasn't one of the general recommendations for chemotherapy patients.
Right. Yeah, the mask thing, man. I wouldn't recognize any of the nurses. Like I seen Julie outside of work and I didn't even recognize her at first. Yeah. Like I had to take a double take. It was her hair that gave it away.
Yes. Yeah, absolutely.
Like I got to know people's eyes pretty good.
Yes. And I'm pretty expressive with my eyes most of the time. So
Okay. So with the whole pandemic thing, we got to talk about it, I guess. Um, would you recommend somebody waiting, like if they got the shot for the vaccine before they did pandemic or before they did chemo, would that wipe it out?
So that's a really good question. I don't think it would completely wipe it out. I think that now we have a lot of information about getting the booster doses and, you know, the right timing to do all of those things. So we're certainly still recommending patients get the vaccine even during treatment, just knowing what part of your cycle or what part of your treatment does it make the most sense for you to get that. But also know that you're probably not going to have the same immune response as somebody who's not going through chemotherapy.
Because you're compromised.
Because you're compromised,
Right. Hence the big word. So a couple of weeks ago, I was watching the news and they were able to detect cancers by taking a blood sample.
Yeah.
Like that was amazing to me. And I was just wondering if this would do away with like the really invasive procedures, like a biopsy or a mammogram or a finger up the booty.
You know, all the fun stuff.
All the great stuff.
Yeah. So I think it will mostly do away with the diagnostic part of things. So biopsying, right? So a lot of these are called liquid biopsies. So we're using blood testing to get that same information. But those screening tests are still going to be super important because early detection is key. So things like your mammogram and your colonoscopy and, you know, prostate exams and all of those things are still going to be recommended because even though we do have a liquid biopsy option, we want to find it before it gets, you know, to an advanced stage where treatment is going to be much more severe.
Right. Oh man, like out of all the things that get tested for cancer, I just feel bad for women the most, man. The mammogram just, why do you got to make it a pancake, man? Why do
you worry about the mammogram, but you don't worry about the pap smear? That one's worse.
The PET scan?
No, the pap smear for women.
Oh, well, yeah. I don't really
you go through all this torture.
Yeah,
You
got a point there, man. I don't know how you guys do that either. I couldn't sit up there in a V shape and just be like, look at me, you know.
Right.
Grab those, grab that duck bill over there and let's go to town.
Right.
All right, Cindy. So where do you see oncology going in the future?
So oncology is one of these fascinating fields that is always changing. Everything changes. Treatments are changing. How we diagnose patients are changing. How we do routine surveillance is changing. So I think the biggest things are in sort of what order do we do things? Do we do surgery up front? Do we do chemo up front? Do we do radiation up front? And that's sort of rapidly evolving and certainly depends on every patient and every diagnosis. But I think the biggest change is immunotherapy. It's a real game changer.
Yeah, but from everything I was studying on it, I was like, wow.
Yeah, it's pretty incredible.
It's only like in the past 10 years that it's really bumped up. Like,
yeah,
it's just
absolutely.
amazing.
Absolutely.
Well, that's all the questions I actually have for you.
Oh, that wasn't even nearly as hard as I thought you were going to be.
Oh, I thought it was going to be a lot harder than this too.
Yeah.
I was very nervous about this one.
Oh.
So I want to thank you for coming on and being our first ever guest on the show.
Thank you for having me. This is super fun. I'm so excited to see the rest of your series.
I'm excited too, actually. That's what I'm curious where it's going to go from here, you know? So on that note, I'm going to say sayonara. Thank you for coming on. And if you ever get into like private practice, you let me know and I'll be your first patient to sign
Well, you're
up.
stuck with me no matter what I do. So
Exactly. Lifetime.
Absolutely.
All right, Cindy, you have a great day.
Thanks, Henry. You too.
Now, I want to remind everybody, I'm not a professional. That was my first interview ever. You know how you think it went? Go down in the comments section or join us on our Facebook page. Just look up Lary Talk. Or we also have a Facebook group I just started last week called Lary World. You go in there, you'll be able to chat with me and some other fans of the show. You can use it for support, posting your memes. You can vent, whatever. Just don't get political and religious on people, and don't post any magic potion solutions for cancer. That's all I'm asking. it's meant just to be a place for us. You, the fans, can interact with me, and we can make it a nice little fun atmosphere. So again, I want to thank Aaron Wayne, and I really want to thank Cynthia Davis from Cayuga Medical Center in Ithaca, New York. I am very humbled that she was able to come on the show. She took time out of her day off to do this, and I am very, very appreciative of it. And I knew she'd be a good fit for the show. So thank you, Cindy. And thank you guys for watching. Join us on LaryTalk.com. Look for us on Facebook. Hit the like and subscribe button. Find us anywhere you get your podcasts. And until next time, take care of each other and have a good one.